Yo, what's up? It's Eric Wong here from Precision Movement, and today we're going to talk about the meniscus and how to recover from a knee meniscus tear. So I'm actually dealing with a knee meniscus tear right now myself. I got mine at the time of shooting this video about 2.5 months ago. And I would say I'm about 90 to 95% to being 100%, okay? And we're gonna talk about exactly how to diagnose it with 3 different tests, as well as 4 exercises to help you get to full recovery. Now, these aren't all the exercises that you're gonna need, and it depends on what sport you do, but these exercises will help to restore the core functions of the knee and to ensure that you have the movement and mobility that's required to keep a meniscus healthy for the long term, okay? So I got my meniscus injury, and I've injured the medial meniscus because I was doing some exercises, experimenting with some exercises, and I got a little too aggressive. And after, it was some rotational stuff of the knee, some deep squat crawling, so the knee was in full flexion, and I had tibial rotation going on. Got my meniscus tear, and right away, the first few days, it was very, very stiff, okay? Now, one way to differentiate between a joint or a connective tissue injury and a muscular strain is simply just do isometrics and activate the different muscles, activate the quads, hamstrings, calves, adductors, whatever muscles that you suspect might be involved, do a strong isometric contraction. And if there's no extra pain, or if there's just a little bit more pain, then it's likely that you've got a connective tissue injury and not a muscular strain, okay? Because if you've got a muscular strain and you do a strong isometric contraction of that muscle, you're gonna feel it. Okay, so that's one quick way to differentiate between muscular strain and connective tissue, like a meniscus injury, okay? So let's go through 3 tests for the meniscus specifically. So the first test is just palpation. You're just gonna touch the joint line. So find your knee and touch right in the medial aspect here and just kind of add some pressure. And if you've got some tenderness going on somewhere in this area, you might have a meniscus injury. Same with the lateral line. You can just kind of palpate and rub right along the knee joint there. And if you've got some tenderness, suspected meniscus. So that's the first test you can do, just kind of get a general idea. Next up, we're gonna go and do some open chain tibial rotation. So the tibia can rotate externally, so when the knee is flexed only, not when it's extended. When the knee is flexed, you can rotate the tibia externally and internally, okay? So here, to test your meniscus, first you wanna go to lift the leg up and then actively bring your knee to into flexion. So if you've got an injury, you're gonna be limited and you're gonna maybe hit an area like, oh, right there is where I have pain. So at that area, you wanna go into external rotation and internal rotation. And one of those directions is likely going to increase your level of pain. If it's external rotation that increases your level of pain, that's your medial meniscus. If it's internal rotation, that's your lateral meniscus, okay? So here, now we've got a little more information on what tissue exactly is painful. So again, active knee flexion to the point of pain. Once you're there, go to external rotation, external tibial rotation, that's gonna be medial meniscus, and then internal rotation, that's gonna test your lateral meniscus. And you can add a little more flexion just to increase the pain there, okay? So that's gonna tell you, okay, lateral and medial meniscus, figure out what tissue it is, then we'll know what we've got to target. Well, we don't even have to target anything. We still wanna restore full function of the joint, regardless of if you have lateral or medial, okay? Just something to look out for. The final test we'll go through is simple one, knee extension, full knee extension. So straighten your knee, and if you cannot achieve full knee extension, what that's indicative of is you might have what's known as a bucket handle tear of the meniscus. And that's when basically the meniscus, there's a rip right in the middle, and it's like the handle of a bucket, okay? What's showing here is that the flap might have folded over, and now it's basically like, say the meniscus is normally like this, the flap folds over itself. You cannot go to a full knee extension anymore because the compression is going to happen and you won't be able to straighten through. Otherwise, you'd be really squeezing that tissue hard, and that would cause just too much pain. So if you cannot achieve full knee extension, you might have a flap that's kind of folded over. And something that happens with that issue is a lot of times it might just go away on its own. The flap might just restore itself. One way to facilitate that is with a little bit of traction. Okay, so with this, you just loop a band around your ankle, lie down, and have the band pulling that way. That's just going to decompress the joint a little bit, and it might allow that meniscus flap to go back and lay flat. Okay, so it's not folded over. All right, so there you have a few different tests to figure out, A, is it my meniscus? And B, what kind of meniscus tear do I have? Whether it's medial, lateral, bucket handle, just gives you a little bit more information, but regardless, the treatment is going to be pretty much the same. Now, there's a study out in 2013 in the New England Journal of Medicine that tested physiotherapy versus surgery. Okay, they had two groups. There was like 350 patients, two groups, and split them in half, sent them into either physio or surgery. And what they found is that 6 months, the pain outcomes and functional outcomes were pretty much the same between both groups. Now that's very important to note. However, what they found is at the 6 month point, 30% of the people who started in the physical therapy group moved over to the surgery group. Okay, so basically what this means is it's probably a good idea just to start with exercise. And if you're going for 6 months and you find either the pain is maintaining, staying the same, or it's getting worse, then surgery might be a good idea. Okay, I'm not against surgery at all. I just think that a lot of times it's prescribed too early, where we could try these more conservative treatment options and find the same level of success. So my suggestion is start with exercise, give it a good go, at least 3 months, but up to 6 months, and then make your decision if you want to go into surgery at that point. Okay, so if you don't want to go into surgery and you want to do some exercises, let's do that right now. So the first technique, I should stay down, I call it open chain tibial rotation isometrics. So what you're going to do is, again, you've got a sore meniscus, so you're going to find the end active range. Okay, so let's say this is my end active range, and any more than that, I get pain. Okay, so end active range, you want to back off just a little bit from there, and all we're going to do is internal and external isometrics. So from here, you're going to go to external rotation, and you're going to keep externally rotating for 5 seconds, hold it, and then you're going to go into internal rotation and hold it for 5 seconds. And you can do 3 repetitions of either of those. Okay, what this is doing is we're firing up the muscles that obviously create external and internal rotation. So this is going to help to facilitate blood flow in the area, which is going to facilitate healing. Because if you're not moving and you're not creating the forces that need to go through the knee for it to be healthy, you're not going to bring in the forces that are needed to strengthen that tissue. So the meniscus is just like ligaments, it's just like tendons, it's just like muscles. It responds to force. And when you load it through, in this case, external and internal rotation, you're creating those forces, and that's going to stimulate recovery. Okay, it's use it or lose it. If you're never loading it, your body's not going to adapt and make that tissue stronger. All right, so that's the first one. Just want to do 3 repetitions, hold for 5 seconds in either direction. Think of it as kind of a warm-up and a restoration and activation of this movement pattern and of these muscles. Okay, next up, simple squats to painless end range, doing 10 repetitions. However you normally squat, like if you do back squats or front squats in the gym, whatever your stance is, do the same stance. This is kind of as a guide to where you're at, okay? Because your range of motion is going to tell you if you're progressing or not. So if you can normally just get down to there before you feel pain, then after a week or 2 weeks, you should be able to get a little bit lower each time, okay? So 10 repetitions, just squat to end range. And like I said, I'm about 2.5 months in, and I can start to feel it right about there, okay? So pretty good. All right, so that is the second exercise. Third exercise, hip bridges with ankle, plantar, and dorsiflexion. So there's a couple of key points here. You're gonna lie down in the supine position. Okay, and I want you, first thing to set up is actively go into knee flexion. And then once you feel the pain, back off of that range a little bit. Okay, so just get out of the painful end range. So all of these exercises, we shouldn't be going into pain repeatedly and trying to force our way through it, but we just work just before pain is elicited, and we're still gonna build strength beyond that range, and this will help, again, to facilitate recovery, blood flow, build strength, and progressively build strength throughout the full range, okay? So here, you're gonna hip bridge. First activation is just squeeze the glutes, fire them up, bridge up, and then from here, maintain the position of the pelvis and the spine, and you're just gonna go into plantar flexion. So lift the heels off the ground by activating the calves, and then slowly into dorsiflexion. Okay, plantar flexion, brief hold, just a couple second hold, and dorsiflexion. Okay, so this you're gonna do anywhere from 4 to 6 cycles of the plantar and dorsiflexion, and then do 3 repetitions of that. Okay, what this is doing is a lot of the exercises that we do are gonna build the knees from the above, so quads, hamstrings, those muscles. This exercise helps to build the knee stability from below, okay? The calves, tibialis anterior, okay? So this way we're hitting all of the muscle groups needed to keep the knee healthy. Okay, so that's the hip bridge with ankle, plantar, and dorsiflexion. 3 repetitions with 4 to 6 cycles between ankle, plantar, and dorsiflexion. Now the last exercise that we're gonna do, you've got to be really conservative with. I call this the one leg tibial rotation squat, okay? So this one you want to go really slow and controlled. Do not go into this with momentum or with speed. Otherwise you're going to injure yourself. But if you do this properly, you're going to strengthen exactly what you need to strengthen to keep the knee healthy, okay? So you're going to load up one leg. So working on my left knee here. And all I'm going to do is I'm going to squat down, keeping the weight on my heel and the ball of my foot, especially underneath the big toe, okay? The weight is evenly distributed there, and I'm just gonna squat down and drive the knee outside of my foot to the left. But make sure you plant the ball of the foot. The foot's gonna wanna lift up like that. I wanna plant the foot, keep the pressure on the foot, on the ball and the heel, and then I'm pushing myself up through this leg, okay? From there, I'm gonna go tibial external rotation, so the knee goes the inside. You can see how it's as if the tibia externally rotated that way. Same thing, I'm gonna squat. This time, keep the feet flat, but a little more pressure on the outside ball of the foot, so the pinky toe. Okay, and heel, foot stays flat. Just go slow, painless end range, and then drive yourself back up using these muscles, okay? This is just here for balance, my right leg. So again, drive the knee to the outside of the foot. Think of pushing the ball of the foot down, keeping the heel flat on the ground, and then push up through the painless end range. And then knee inside of the foot, think of pushing through the pinky toe, metatarsal, and keep the weight on the heel here, okay? And you'll want to do about 6 repetitions of either. Going slow and under control. Think of that map, I call it, the movement and or activation pattern that I described, and that's going to build up the stability of the whole lower limb from the foot up to the hip. Yeah, so it's going to integrate that all. And what you'll find is as you do these exercises, I recommend you do them on a daily basis. It's not a lot. It's going to, once you get them down, it's going to take you about 5 minutes to do. But this is going to simultaneously speed healing, build strength and stability, and it's going to ensure that you're increasing the mobility, the range that is needed, okay? okay? Because if you don't have good rotation of the tibia, then anytime you get into that, whether it's in sport or training, whenever you're forced there, you're gonna hit end range very quickly, and that's where you can damage the tissue, okay? So those are 4 exercises to get you on the path to full recovery. If you're just doing leg extensions and hamstring curls, you're gonna heal. The meniscus is just gonna heal over time, but you're not building that all-important rotational mobility of the knee that is critical for meniscus injuries, okay? You've gotta restore that. So there you have it, tests and exercises for full medial or full meniscus recovery. And whether it's medial or lateral, it doesn't matter, okay? If it's medial, in my case, you're just gonna hurt a little bit more whenever you do tibial external rotation techniques. So turning the foot out, or when you're squatting, the knee going inside the foot, okay? And vice versa for lateral. The pain is gonna increase a little bit sooner, but you're always working the painless end range anyway, so it doesn't matter. And these techniques apply to both conditions, all right? So these are just 4 exercises. Now, I've got a complete course called Lower Limb Control that works everything, restores full function, and takes you from basic techniques, some of which we showed here, to more advanced techniques where you're actually getting into some ballistics and some jumping, some plyometric type techniques, okay? And that's important to train as well, because if we're jumping, we're running in real life, then we gotta rehabilitate ourselves using those techniques so we don't continue to re-injure ourselves and continue to stress those tissues. So check that out. You can go to precisionmovement.coach/lower-limb-control. Put a link down there. Don't expect you to remember that in the description and at the end of the video. If you wanna ensure that your whole lower limb is functioning properly to prevent injury and heal any problems that you're having right now. Okay, so thanks again for checking this video out. I'll see you next time. Peace.